Hello, good afternoon, everybody. Thanks for joining us. So you're welcome to the third palliative care seminar that is brought to you by St. Cyril Cancer Treatment. Yeah, so we're going to start right about now. Just need you to relax because you're going to learn a lot. We're going to hear a lot. I am so eager to meet the speakers because I've already done a lot of background check, and trust me, they have a lot of things dropped. So we're ready to learn, ready to get informed and get educated about anything you need to know about cancer, suicide, mental health, and every other thing you need to know about your health. So before we get started, we're going to have the chairman's opening remark. Yeah, right about now. So just hang on. The chairman is going to give us her opening remark. Thank you.
Good morning, good afternoon, good evening, wherever you may be. Welcome to St. Cyril Cancer Treatment Foundation's third palliative care seminar. Palliative care is essential, especially in LMICs like Nigeria, as many of our patients start treatment late. Our focus on mental health this year is because this is a critical but often unaddressed part of care of our cancer patients. We hope you benefit from listening to our two accomplished speakers. Thank you for taking time out to be with us. Bye.
Oh, thank you so much, Mr. Tola Atikoja. Thank you so much for your remark. We really appreciate you. We hope that by the end of this seminar, we're going to learn a lot and lives will be impacted and we can reach out to a lot of people who really need help. So moving on to the agenda, we're just going to start. I'm sure our speakers are ready for us. I'm really sure they're ready for us. So I'm going to introduce our first speaker. She's someone you want to meet. She's someone you want to learn from. Someone you need to actually listen to. So she's Miss Titilayo Tade. She's the Deputy Director and Medical Service. She's the Deputy Director and Medical Social Service at the Lagos University Teaching Hospital in Lutz. Ms. Tade lectures in various schools and has practiced as a medical social worker across various fields, including mental health, pediatrics, disability, assisted fertility and reproductive health. Ms. Tade is a member of Lutz Health Research and Ethics Committee. Ms. Tade is also lectures in the Department of Social Work and the College of Medicine, University of Lagos. She is also a board member of several non-profits, including Suicide Research and Prevention Initiative, SUPIN, Benola, a cerebral palsy initiative, Make Me Walk Well Foundation, sorry about that. She's a pioneer of HIV and AIDS hotline trainer for the first HIV and AIDS hotline in Nigeria. She supported the establishment of the SUPIN hotlines in 2017. As an experienced trainer and facilitator, Ms. Tade has also worked and provided training and facilitation in diverse communities in Nigeria, Senegal, Uganda, South Africa, Canada, and Italy. Ms. Tade is a fellow of the Leadership in Environment and Development International Lead. Ladies and gentlemen, I know we can't really put our hands together, but we can still put our hands together as we welcome Ms. Tade. Ms. Tade, are you with us?
Yes, I am. Good afternoon. Thank you so much for having me. I hope you can all hear me clearly.
Good afternoon. Oh, you look great.
Thank you.
How are you? How's your day been?
It's been fun.
Okay, so I've really been looking forward to meeting you. Talking about the importance of counseling for breast cancer survivors. You know, when I got this topic, you know, when you talk about mental health, there's a lot of issues around it. But hearing importance of counseling for breast cancer survivors, I'm like, why is it important? Because if you've gone through the whole cancer problems and the traumas that come with it, and you're able to survive cancer, why is it important for you to also go for counseling? So you need to educate me personally, because I have someone that actually survived breast cancer, and I just feel there's no point for her going for counseling since you're able to survive the whole cancer trauma and all. So why is it important? Please, I really need to learn because I have issues with that personally.
Okay,
can you hear?
I can hear you. I've been trying to unmute myself. It wasn't unmuted.
Oh, okay. Oh, wow.
All right. Thank you very much. Like I said,
Yeah,
for having
I
me
have.
on.
It
Yes.
wasn't loud enough.
So can you hear me? Can you hear me?
Yes, I can hear you. Yes, I
All
can.
right.
Yes.
All right. So I was saying that counseling is something that's very important for everybody. Most people think that you only get counseling when something is wrong, but the reality is you can get counseling if not even when you're going through a cancer diagnosis. You can get counseling for simple as something as simple as career counseling. Children are in school. We talk about school counselors. So counseling can be provided at any point in time. It's just what is it is being provided for, and how the counseling is provided. And I'm hoping that you'll be able to pick up more from what I have to share with you today. So thank you so much, like I said, once again for having me, and I'll just jump right into the presentation. Can I have the next slide, please? Okay, so I'm sharing from my laptop now. I hope this will be better, and I hope everyone can hear. Thank you very much. So we're talking about counseling, what counseling is. And before I go into counseling proper, I'd just like to say, obviously, that when people get a diagnosis of breast cancer, there's a lot of emotions going through. There's fear, there's anxiety, there's a worry for the future, and then even a worry about the cost of the treatment process. So it's traumatizing not just for the individual, but for the loved ones around the person, the spouse, the children, the parents, other significant others. So for everybody involved, the journey is very scary for the person and for those who are going to be providing support, providing care while the individual is going through treatment. Now, the effects we all know is not just physical, because obviously while you're going through treatment, there's a lot of physical changes, things like nausea, you have fatigue, all those things. And even after building back after your treatment to your health status prior to getting treatment is an arduous journey on its own. But there's also a lot of emotional disturbance. There's a lot of social and financial disturbance. There's a lot of social and financial instability in the family, because we all know the treatment for cancer in Nigeria, we don't have insurance, and treatment for cancer is very, very expensive. So first and foremost, not you have the fear of what you're going to go through physically, but then also financially, and then socially, how it's going to affect your family, the children, and everybody else. So people go through what we call the stages of grief. And during those stages of grief, they're about different emotions. First, there's anger at how can this be happening to me? It might be anger at God, anger at other people. Why is it me, not other people? People are going through a lot of emotions. There's denial in the sense that it's not me. It can't be happening to me. The denial sometimes can get so bad that people will refuse treatment. Will ignore treatment. Will ignore medical advice because they're hoping that it's not real. There's bargaining. God, please let me survive this. Or if you let the diagnosis be wrong, this is what I will do. I will become a better person. I will do this. I'll start going to church. Then there's depression, and depression is very important when it comes to the issue of mental health. The period of when the person is going through this low mood because of the diagnosis. And depression is something that everybody feels, but there's a difference between what we call clinical depression, when there's a diagnosis made in the hospital that person is clinically depressed. It's totally different from being depressed at a certain news you've gotten, and then after a few days you pick up and move on. With people that have clinical depression, you don't pick up after a few days and move on. It is something that becomes part of you. It wears you down. It wears you down emotionally, physically, everything. And the people that have clinical depression need help when it comes to getting out of depression. It might clinical help. It might be therapeutic help. We'll talk about that. And then acceptance of the diagnosis, acceptance of the treatment, acceptance of the fact that after treatment and it's been successful, one will still have coming back for checkup to ensure that the cancer doesn't come back, doesn't reoccur anywhere else. So the acceptance of the fact that one has to live with this diagnosis now. So, those different stages are not stages that happen sequentially. It can happen at any point in time, and it doesn't follow in any order. Somebody might be accepting at the beginning, and then something will trigger the person, and the person go into denial. So at this point in time, all those things are what people are they're battling with. And one of the things I would like to mention is that even though, because you said, oh, the person has gone through the treatment, person, been successful, it doesn't stop this emotion from still occurring. Because even when the person has gone through the treatment successfully, the person might still have this thing that's why me? What has my family done to deserve this? So those emotions are things that people are still battling with within themselves internally. So let's look at what counseling is before we talk about why counseling is important. Counseling is a helping process with stated objectives and goals. It is a talking therapy. So counseling is not just we sit down and we're talking. We must have an objective for counseling. There must be a reason why we're sitting down here. So when you come to a counselor, the counselor will talk to you and do an assessment. And speak with you that why do you think you're here? What are the challenges you're facing? And then you can identify, you might even identify 10 challenges, you might identify one, or you might identify up to 10. Then the counselor will help you prioritize what are the challenges we need to deal with? What are the things that we need to address immediately that is affecting you immediately? So there's stated objectives, there's stated goals. And it is done through just talking, and that's why it's called talking therapy. It is client-centered, interactive communication process. And this is very important. Counseling is always focused on the client. It has nothing to do with the counselor. It has nothing to do with your setting or whatever. It is the client that drives the counseling. It's the client that determines how quickly we're going to go, how slowly we're going to go, how in-depth we can go. Because it's the client that feeds us as to what can or cannot be done. Now, there's different types of counseling. There's individual counseling for one person as an individual. There's couple counseling. Couple counseling is given to people who are married, spouses, boyfriend, girlfriend, partners. It might be people in formal relationship, but you provide for a couple who are significant others to each other. Then family. So it might be the whole family with the kids. It might be siblings, it might be parents. It's just something that is given as they said, couple of family. And then you have group counseling. Group counseling is counseling that we might look at maybe like a support group where women or who have also had breast cancer are coming together in a group to provide support to one another. So we talk about what counseling is. What is it not? It's not an interrogation. It's not we're not there to say, yeah, so when were you diagnosed? What happened? What did they say? What didn't they say? What did this person do? Or what did that person do? It's not an interrogation. It may seem like because you're asking questions, you're probing, but the counselor is skilled. The counselor probes gently and is able to get you to talk openly about certain things. So a lot of the other information we need, we're getting without asking too many questions. So it's not an interrogation. And it's not the counselor giving an opinion about what they think the client needs. It's not. Your counselor should never give a personal opinion about what they think. They should be discussing with you about what your needs are. And it's not giving advice. Giving advice means you know better than that person. You never know better than the person that is going through a problem. Never, because you're not walking in that person's shoes. You're not that person. You have not lived that person's life. You're not experiencing what that person is experiencing. So you cannot give advice for what you're not living through. But you can provide support to make that person come to a decision about certain things. You can provide professional options. What are the options you have? What are the things you can do? But never say, this is what you must do. And it's not a conversation where we're just gisting. Sometimes I know that some people say, oh, my counselor is always feels as if I'm gisting with her. Your counselor is quite good because if you feel as if you're gisting with your counselor, then your counselor has made you relax to the point that you're not even realizing that you are actually giving yourself some sort of catharsis by just talking. You are allowing yourself to feel to ease a lot of the burden psychologically that you're feeling by talking. And you found her so easy or him so easy to talk to that you're unburdening without pressure, without them pushing at you. So it's not gisting. And it's not sympathizing. It's not, hey, yeah, only you. Why is this thing happening to you? That's not what counseling is. Counseling is we empathize, but we don't sympathize. We ensure that you know that we feel with you, but we can't feel what you are going through. We can only feel with you and will help you, of course, during the journey. And then it is not praying. Counseling is not praying. If you want to go into a prayer session, enter your church, enter your mosque, enter anywhere. But in a counseling session, it's not a prayer session. So it's important that we note that it is not a prayer session. And I know that a lot of times some people confuse the two. There's pastoral counseling, people who go to pastors for counseling. Yes, if you're with a pastoral counselor, the counselor can do, and whoever the pastoral counselor is might want to do a prayer for you at the beginning or end of the session. But when you go to a professional counselor, it is not a prayer session. So why is counseling important? Now I'm going to run through a lot of some studies, and I'm going to tell you what the studies say, and so that we understand why counseling is important. One of the first things that studies have shown is that women with breast cancer experience anxiety. Yes, anxiety because of the future, anxiety because of treatment, but even post-treatment, anxiety because they're worried if the condition will come back. If you're a woman with breast cancer and you have females, you're worried about your children, whether they will get breast cancer. So there's a lot of anxiety that you're dealing with. You're worried about your siblings. You're worried about, you're worried. They say it can run in families. What if somebody gets it? What if, so there's a lot of worry, anxiety there. There's long-term psychological distress. The distress is not just at the point of diagnosis. The distress is something you carry with you as you make that journey. And because you've survived cancer does not mean that you will shed that toga. It's like saying you're worried about something and that automatically, maybe you're worried about paying your house rent, and automatically once the money comes in, that you stop worrying about money. It's not possible. Once you pay your house rent, there's something else that you worry about. So the psychological distress follows you, because once you think you've resolved one issue, something else will pop up because you've not dealt with the underlying problems that affect you. Clinical depression, like I said. Clinical depression, studies have shown that women with breast cancer who survive breast cancer are more likely to have clinical depression. And what the studies also show is women with breast cancer, women with depression, clinical depression, are more likely are less likely to survive breast cancer with clinical depression. And this is very important, what I want to say here, because they're less likely to survive the breast cancer, irrespective of the prognosis. Irrespective of the prognosis, it doesn't matter whether the doctor says the prognosis is fine, whether the treatment is doing well. The fact that they just have that depression can affect them to the point where it would lead them to less likely to survive. And the reason why this is because they start doing things that make them survive. They stop eating healthy. They stop caring for themselves. They stop doing things that the doctor will say because they're in a depressed state. So they're not ready or willing to look after themselves. So the things that would enable them to survive, they're not willing to do. And that further now makes the situation worse. So it's not even the diagnosis of the cancer or whether the treatment is being successful that's the problem. It's the fact that they're in a state at which they can't help themselves when they're clinically depressed. And for people that are clinically depressed, it's important for us to note that if you don't get treatment, you may think the depression will lift, but it will come back. It will wane, it will come back. It will wane, it will come back. So it needs to be addressed. So, and that's why people who may have survived breast cancer will still be depressed after surviving it, and will still need support. Now, studies also show, and I know all of us will know, that women with poor support are more likely to experience psychological difficulties. If you don't have support while you're going through the treatment, then you most likely will not have support after the treatment, and you'll have to do things on your own. So when there's no support, the person is more likely to fall into psychological distress than other people who have adequate support, people around them, people who are checking up on them, people who are trying to make sure they're doing things and they're well. Now, it's also important to note that studies have shown that husbands to women who have been diagnosed with breast cancer are also 40% more likely themselves to suffer from severe depression and mood disorders. For the fact that their wives have been diagnosed, their wife is going through treatment, their spouse themselves would likely go through a mood disorder and severe depression. So the person who's supposed to be supportive, who's supposed to help you, if he himself is going through clinical depression, then the person is unable to provide support that that individual needs at that point in time. And if the woman that is going to that has survived the breast cancer does not understand that her husband too has these challenges or is depressed, she might just be wondering why he's not being supported, or known to her that there are issues going on with him as well. So that is a very big pointer as to when I talk about the different types of counseling: individual, couple, family, and group. That is why when we talk about family counseling, even in breast cancer, that it will be important to bring in the loved one, because we need to understand what they are going through, and so that we can ensure that as a unit they'll be able to face the issue together. Counseling provides support, provides education, it provides empowerment, and it also provides guidance about how to manage significant relationships. Sometimes when you are angry at a diagnosis, or you've survived the cancer and you're still harboring a lot of anger, you will lash out at people you should not lash out. People that have supported you during this period, you will get angry at them, you will be upset with them, and you may disrupt relationships that would help you during your post treatment period. So counseling in itself, even though we talked about it being provided before, but I'm sure now you can see why there's a need for the counseling to go in during and even after treatment. For everybody, it's different, but it's very important that women will provide this counseling. So why is counseling important? One, it helps with survivors gain emotional stability and control. When you've been given a diagnosis and when you're undergoing treatment, you're like a seesaw. This is how you're wading up and back and forth. You're back and forth. Sometimes the counseling grounds you. It helps you take control of your emotions. It helps you to be able to express your emotions better and understand what you're going through. It helps you to address issues such as anxiety and depression that are issues that are underlying that you don't want to address. Sometimes, because of the way we've been brought up religiously, you will say don't confess negative things. So if somebody is feeling fear, anxiety, and depression, instead of the person to deal with anxiety or depression, the person will say, I'm a conqueror. I am not afraid. I am not this. The person will be casting and binding, and meanwhile the person is undergoing a lot of pressure, and if it's not dealt with immediately, it will still come back and haunt the person eventually. Again, counseling provides a sense of not being alone, especially when you do group counseling and you see other people that have gone through this journey. And I mean, there's 5 years post cancer, 10 years, 15, 20 years post cancer. It gives you a boost, it gives you confidence, it empowers you to be able to say, what are you doing? Let me learn. Let me be able to do some of these things so that I can walk back in my own journey. And then it also makes you understand that it's important for you to be able to, as people have laid the path to guide you, it's also important for you to guide those coming behind you, because yes, there'll be other people who will be diagnosed after you who will also look towards you, as for guidance. It helps you to cope with symptoms and side effects such as pain, fatigue that can occur. You're taking medications, all those sort of things, because when you're dealing with when you're getting counseling, it helps you understand that these things are temporal things. You have to push through it, and you might, it's just see the light at the end of the tunnel. It helps you to deal with self-esteem issues surrounding body image, intimacy, and sexual relationships. Because the reality is, we understand that women, if you get a mastectomy, for example, for a lot of us women, we have been the way we've been brought up. We've been brought up that our breasts are a very important part of our body. You're a woman because of your breasts, and once you don't have breasts, then you're not considered a woman, or people will make fun of you. So those are issues that need to be dealt with. Body image. There's some people that don't have body image issues, but there's some people that have struggled with body image issues prior to even getting a breast cancer diagnosis. Then getting a breast cancer diagnosis will just worsen the issue. Counseling helps you to begin to plan for your future. Counseling shows you that there is life after and you can live. It helps the person to plan for the future. The counselor can also help the person hold sessions with family, with friends, just to be able to deal with the issues that she's angry at this time. And these are the reasons why she's angry. She's not angry at you particularly. She's angry at the world. So during this period that she's angry, if she lashes out at you, you understand with her, work through it with her. Don't get angry and react. And when you react, the emotions pile up and things just escalate. So the counselor can help the family understand how they are all feeling and how how to sort of help each other through that issue. It can lead to identifying support groups. If you work with a counselor that has experience in breast cancer, she might probably have networks to be able to lead you into different support groups in different parts of the country, depending on where you're coming from. So I don't know how large the networks are. I don't know how large an experienced counselor in that area may have this kind of connection, or might be able to even set up a support group so that women will come together maybe once a month, talk about what they're doing and how they're surviving. It can help us identify ways to adapt to changes, because the reality is, post your treatment, you're going to go back to work eventually. Your career path might need to change, because you might have to change, because based on maybe you were working around chemicals before. The doctors may say you don't, they would recommend you don't work around those kind of chemicals any longer. You might have to change career, the finances, and all of those things. So it will help you to start identifying what are your strengths, what are the things you can work on, what are the things you need to work on, and how best do you want to move forward. And counseling can also help you communicate with the health team. So I work in a hospital, and I know that I'm a social worker. One of the biggest issues we have is how sometimes the patient says, the doctors never listen to us. The medical team don't understand what I'm going through. They don't understand how I feel. So if you have a good counselor, a social worker, whoever it is that's providing the counseling, but counseling can be provided by a wide range of people. Whoever is providing, they can help you sit down and discuss with the team about what your fears are, what your challenges are. I know that with surgeons, at times surgeons can be very brash. They will tell you, oh, we just need to do the surgery. We'll go there and we'll just cut it. That's how they talk. But for you, it's not an if, it's your body. You understand? It's precious to you. So you need them to understand that you are handing them something that's precious, and they need to deal with it as if the way you respect and have regard for your body. So sometimes the counselor can help you sit with the team and communicate your fears, your anxiety, so that everybody is on the same page about counseling. So on a final note, I would like to say counseling doesn't work magic. It's not a miracle cure for everything. But what it tries to do is, when there's chaos, it tries to help you organize the chaos. It tries to help you prioritize and determine what can be dealt with immediately, what we can postpone to later, what needs to be addressed, how do we address it, and how best to move forward. Thank you very much, ladies and gentlemen.
Thank you so much. Thank you, Mr. D. That was amazing. I really learned a lot. Please, let's not forget, if you have questions or even comments, or you need to get something right or straight, please don't forget to drop your questions or comments on the chat box. So, Mr. D, there's this part you said that really struck me, and that's dealing with this transition stage. Because once you're done with treating your cancer, yes, you still have the suicidal thoughts, and probably you're thinking, I'm not good enough, I'm not perfect enough, this and that, and then the society. So how do you think a cancer survivor can actually deal with the societal, what should I use, judgment that comes with it? Because I know the discomfort that comes with you not being comfortable with your body. If it gets to the case, your breast has to be taken off and other parts of your body needs to be taken off, whichever case it may be. So how can survivors like that manage it aside from the counseling? Because like you said, a counselor will not feel exactly the way you feel, because you are the best person in the position to give or tell how you feel. So how do you deal with that particular situation?
All right. So thank you very much for that question. So when you come in for counseling is different from psychotherapy. So psychotherapy deals with a lot of underlying psychological issues the person may have. So counseling will come in, and then if the counselor is somebody who's experienced, especially with mental health, they provide counseling. But in the process of providing counseling, they see that you have more in-depth psychological issues with your body image. They might refer to a clinical psychologist, so that a clinical psychologist will walk through with the individual on how to overcome those challenges. Now, if they're just the regular challenges that come with, any with bodily changes, anybody's bodily changes, the counseling can help you identify what your fear is. What is this society is judging you, or are you judging yourself? So because sometimes you find out that society doesn't even realize that you've had a mastectomy. You are the one that knows, and you're self-stigmatizing yourself. So you go into certain places, you feel awkward. The person is not able to behave comfortably. So first, a counselor where I help you identify what are the challenges. Are you the one being over anxious? Are you the one noticing things that people don't notice? So you want to identify those things, and then after identifying those steps, then you know how best to deal with them. Like I said, for people that have had deep-rooted body issues, body self-esteem issues, even before the cancer diagnosis, it might require them seeing a clinical psychologist and going for more in-depth sessions, therapeutic sessions. But if it's things that are just reactive, the counselor can work through with you, like I said, identifying what those particular issues are and then deal with them. If you're worried that your spouse is not going to find you attractive any longer, the question is, we're all adults here, so I'm going to ask the question. So one of the questions you can ask is, was your husband a breast man in the first place? Because not all men that are breast men, quote unquote. So you might have to ask questions that may seem a bit, very intimate, but those are questions that you need to ask to be able to put the person in that space of comfort. Because if the husband isn't worried about the fact that she's had a mastectomy, and if she's so worried, if the person has the funds, does the person want to go into thinking of getting surgical implants, breast implants, so all those things are things that it's a wide spectrum. So with each different individual, we deal with it as.
Okay, thank you so much. It's really amazing. I've learned a lot. We'll have to take more questions after the second speaker. So just hang on. Yes. Okay, guys, I hope you're enjoying the section and you're learning a lot. So we have to introduce the next speaker. I was just going to read her profile and she will come up. I guess, yeah, she's here already. Okay, so we are having next Miss Rupali. She is the founder and chief coach. Meet Yourself with Rupali. She's an emotional intelligence coach. She helps youth and women and men realize their dream and life purpose by overcoming various blocks, beliefs, by being emotionally intelligent. Ms. Rupali conducts EQ sessions for women empowerment groups and corporate networking groups and various NGOs. She talks about emotional well-being, resilience, and motivating inner transformation. Having successfully coached many looking for a life purpose, helping them to bridge the gap between them and their dreams and life challenges, and realizing their hidden strengths under the banner Meet Yourself with Rupali. She has also been featured in a book, Women Entrepreneurs, A Journey from Can I to I Can, which was launched in Third Literary Festival in 2017 in India. She is a member of ANLP in Licensed to Use Training Methods, Unlocking EQ, ICF Approved Coaching Training Hours, ACSTH, Dream Analyst, EQ Fellow, EQ Brain Assessor and Brain Profiler, Neuro-Linguistic Practitioner, Reiki Master Healer, Panic Healer, and Master in Business Administration, International Business. Ladies and gentlemen, let's welcome Rupali. It's nice to have you. Good afternoon from Nigeria.
Thank you so much. Thank you so much for a warm welcome. Thank you so much.
Welcome. So how's it been? How's COVID been?
Oh, I've been doing good. Yes.
Yeah. Oh, this is amazing. So are you going to talk to us about emotional intelligence awareness for breast cancer survivors? Because I know that one important thing as established by our first speaker that has to do with survivors is their mental state. Yes. Absolutely. So coming from the whole breast cancer surviving and the whole process, your whole chemotherapy or whichever method you have used to actually work on your cancer treatment. What is the emotional part? How do you handle that? Because it's very important. Everybody needs to know that. Yeah.
Absolutely, yes. Emotions, they are deep wired within us, whether we like it or not. And we don't pay attention to our emotions most of the time because we have never been raised like that. For us, the IQ, IQ has been more important than EQ. Raising children nobody spoke about emotions when we were young. Nobody spoke about importance of emotions, paying attention to your emotions. And emotion is such an integral part of our existence. It defines the world within us and outside us and around us, and how we connect to people. And when we connect to people in a very sensitive and a compassionate way, things are magical, right? Things are really magical.
Yeah.
Yeah. So I'll just start my presentation. Yeah.
Okay.
Hello, how are you? I'm good, thank you. We need to get away from these surface level programs now, because it's the most important question of our lives. How are you? Because our universe actually initiates from us and within us. So do we actually look into it before we actually say, I'm fine, I'm doing good? Just a minute, just a minute. So let me start by sharing you and taking you a journey of a very young mom called Ria and her challenging, life-changing experience. 2011, Ria sat numb, bewildered on a hospital bed. Suddenly, the life is different. She is terrified and numb and trying to make sense of what is going on around and within her. It was all chaotic and something she could never imagine could ever happen to her. It was her diagnosis with breast cancer. And then she had a young baby, 3-month-old baby, to whom she was very passionate, loving mom. And she had her own dreams and aspirations for being a mom, like we all do. But now suddenly the life took a different turn. So what kind of emotions Ria was feeling was a life-changing event for her. She was in a complete denial, uncertainty, fears, doubts, anxiety, especially when it came to her and her family. The first thing which she thought was her children, keeping herself behind. It's a typical women, I think women are wired this way all across the world. When it comes to family and children, we tend to think about our children first, our family first, and then it comes to us. Take example of airlines, right? What do they tell you in life-changing, life-challenging times? You need to take care of yourself, wear your mask first. Then you can help others, right? So challenges with, when you're diagnosed or in the treatment or your survivor, emotions will always play an important role. So let's understand what are emotions. Emotions are a little data for us, from us, for ourselves. They are like little messengers in our body, which tell us that, this trigger needs to be given attention to. And when we talk about emotional intelligence, just a minute, sorry. Okay, we know that emotional intelligence, being emotionally aware, will not cure any challenge, will not cure breast cancer, but it will definitely equip you to face these challenges, handle these challenges in a more amicable way, more peaceful way, so that you have a better relationship, and then you become more resilient to handle the challenge and a better connection with people around you and with yourself too. Life happens to all of us, and we have these life challenges whether we want them or not. But with emotional intelligence, we have the right tools to face these challenges, and as a result, we are happier, healthier, and more composed and more resilient towards life challenges and situations which, there are times we do not get a notice period of this is the challenge, this is what's going to happen. But then if we have the right kind of mind, right kind of tools, how to face these challenges, I think we can sail through any big challenge in our life, any challenges in our life. Nature has gifted us emotions, and we overlooked, we did not pay attention to our emotions. So we have, according to Robert Bluchick, the very famous American psychologist, we are wired, hardwired with these 8 basic human emotions, and we function throughout our lives based on these emotions. And these are joy, trust, surprise, sadness, anticipation, anger, and disgust. We have experienced these challenges throughout our life. and we will continue to have them throughout in our lives. Emotions are complex and mysterious and overwhelming to understand. And if they're complex to understand, the bigger question is, how do we manage them? Why emotions are important? What makes us, what is emotional intelligence, and why should we pay attention to our emotions? Emotions are like a data for us from ourselves. Emotions are like chemical released in our response to our interpretation of a specific trigger. It takes our brains about 1/4 second to identify the trigger and about 1/4 seconds to produce the chemicals. By the way, emotional chemicals are released by the body, not just in our brains. This is a form of kind of a feedback loop between our brain and bodies, and it lasts for just about 6 seconds. Can you imagine? Only 6 seconds. Only 6 seconds to feel an emotion. Why this is important? Because emotions come first and then feelings, and then emotional chemicals go into work in our bodies, and then the mood develops from the combination of different feelings which we experience. Feelings happen to integrate the emotion, to think about it. Let's soak it in. English, we use word feeling for both emotional and physical sensation. We can say that physically we feel cold, but we can also say emotionally we are cold. This is a clue to the meaning of feeling. It's something we sense. Feelings are more cognitively saturated as an emotion. Chemicals are produced in our brain and body. Feelings are often fueled by the mix of emotions that last much longer than our emotions. And then we talk about moods. What are moods? We have different moods throughout a day, and one mood can actually be with us for a couple of days as well, right? So we use this word often when we become victim to our moods. Most of the time, moods are more generalized. They are not tied to a specific incident or collection of important mood is heavily influenced by several factors. So mood, when you say mood, the contributing factors to the mood would be environment in which you're living, the people around you, physiology, your own physiology, and the kind of health challenges you have, or what you're eating, whether you exercise, whether you have a healthy, or what kind of challenging mental state you have. It depends. The mood actually depends. So mood can last for hours and sometimes even for days. So now the bigger question is why? So why do we see emotions play a good role here? Three things we should know: that emotions are very important, and we realize that our emotional intelligence matters to the world, for our inner world too. Three major ways to describe emotional intelligence would be: it's a learnable and measurable skill. It changes over time. What emotions you feel today, you cannot be feeling the same emotion probably sometime later. It would change. So emotions are contagious and infectious, and they are very powerful. We have all met people, and we have seen people around us who are emotionally very high on energy, and you want to be around with such people. And then there are people who are completely opposite, who are completely emotionally drained out and very low. Do we really want such people around us? Do we actually want this kind of people who are very low on energy, no on emotions? So, and the third thing is, when we say emotions are a data, there is nothing known as good or bad emotion. Emotion is a data. We need to use it as a data to feel what we feel and take appropriate action and become more aware of why we are feeling what we are feeling, what are the triggers, and how can we work on these triggers to have a better resilient, to work out on our fears and mental health challenges which we face. So why do we need to develop into emotional intelligence? We can never and cannot exist without emotions. We carry emotions everywhere we go, day in and day out. Emotional intelligence is important to have a successful relationship with oneself and with people around us. Numerous studies have been done, and the findings are emotional intelligence to a critical life success factors such as effectiveness, relationships, well-being, and the quality of life. And finally, your own happiness, your own resilient behavior towards life challenges. We are not. So we have this Daniel Coleman, who is considered to be a father of emotional intelligence, and his popular American book, Emotional Intelligence, is how we handle ourselves, manage ourselves, lead ourselves, and how we handle our relationships. He sees emotional intelligence in two ways, self and social. Let's start to understand how emotional awareness or emotional intelligence helps us for ourselves. Self-awareness is the step one of our own emotions. As we spread these emotions to other people around us, because we know that emotions can be contagious, they can actually travel around us too. When people feel that energy, when you're emotionally high on a good emotion, your body would actually be very different. Your energy level would be very different. So it is a reactive response tool to show people to manage moments better with a confidence to manage their own personal drive while being mindful. Now, why social skills? This is where we need to step outside our own bubble and we give attention to others around us and being able to connect. We know that when we connect well with others, with compassion and with love and with good understanding and without judgment, we work better and we connect better with people around us. Ability to have empathy is only when we connect well with other people. And it is very important when you're in a social group or in a family or with your friends or in a workplace, when you're working in a compassionate way and you connect with people in a non-judgmental way and you listen to them. Listening is again a very big challenge these days because we are so consumed with our own world. We forget to pay attention what is happening around us, what is happening with the people around you. They might just need you, and sometimes you just need to talk it out. And when we're talking out our low moments or challenging times, we need to have active listening. Active listening is a skill. It is, we normally don't listen. We are only hearing to reply. So that is where, you could actually have a disconnect. So this is one major, aspect of emotional intelligence, that you need to be empathetic. You need to feel that empathy, paying attention to emotions and feelings of others around us. So according to Daniel Coleman, we have these three main pursuits of emotional intelligence. This would be to become more aware, noticing what you do. Ask yourself, what am I feeling? Notice your feelings and reactions. Get out to the autopilot, tune into what is happening inside. Suppose you are feeling angry about something. When you are angry, it is not, there is a disconnect between you and your self-belief and what is actually coming from outside. So anger most of the time is a reason, it is not in sync with our belief system and it's something outside our body. And that is the reaction of our body and emotion showing that this is not acceptable by me. Anger to an extent is good because it defines your boundary, what can be tolerated, what should not be tolerated. So when we are emotionally working on our anger means you identify your triggers, you acknowledge your anger, you identify what made you angry, what is the different strategy or perspective you might want to work on so that you do not feel angry about the same concern, same challenge again. So the second point coming after becoming more awareness would be to become more intentional, doing what you mean. What options do you have to not to feel angry about that particular moment again? Either you walk away or think differently. Again, empathize with the person if you're angry with the person. Understand why did you get angry? What was the reason? Why is it happening? or you had that anger within yourself. When you are talking about getting angry with yourself, it's again comes down from a past, something which you did not resonate with, something which you could not work, something which is a challenge which you need to work on. Anger is a very strong emotion. It is again a data which is telling you that something is not right, something is not acceptable, something is going against your belief systems. So when we are more intentional, when we work on our anger, we tend to have a better relation. We work better with ourselves too. And then finally, to become more purposeful, doing it for a reason. You need to ask these questions to yourself. What do I really want? Remember what is truly important to you. Consider others and move forward. What is it that, what is your purpose? If you're getting angry, okay, now you worked on your anger. What was the purpose? What is the purpose of why you needed to work on your anger? You needed to work on your anger because you have a better relationship with yourself and people around you, so that you do not have a heated argument. You do not feel the same anxiety within you. You do not feel, sad or, the kind of feelings which you feel, because all of us react to anger in our own personal ways. Some might just go numb. Some might just mute themselves. Some people shout. Some people get angry, or some people just clam up. So we need to consider and take into account the way we react to angers and then work on it. Emotions drive people. Emotions are like a fuel for us. It tells us, when you're emotionally high, when you love doing what you love to do, imagine the kind of emotions you would be feeling: joy, happiness, ecstasy, right? When you are appreciated in your home and at a workplace, you work better. You are motivated to work better. You feel a strong connection to that person or the workplace. So same thing is when we work on ourselves too. And we women are quite an expert in ignoring our emotions, be it anywhere in the world. We are, as a woman, first thing is like family, my home, my finance, my children, illness, this, that. The list is on and on, and it's a long list. Where does the woman put herself? Where does she put herself? Where did she leave herself behind? We all need to answer this. We all need to understand that we matter. We are humans, right? Our emotions matter too. First to ourselves, and then when we are composed and confident and resilient with our own selves, we can actually give out to the world around us, our families, our friends. Challenges will always be there. Life has never been easy for anyone. Challenges would be always there, but then how we face these challenges, how emotionally intelligent we are to face these kind of challenges is what is our purpose of life today. Breast cancer survivors, the patients, and people who are going through it, they can actually feel a lot of emotions throughout the day. And do you actually note down? Do you actually answer when somebody's asking you, how are you feeling? Do you just answer without thinking, or you are in an auto mode that, yes, I'm fine, everything is good? Do you actually look within what you're feeling and why you should be answering a question which is so important in your life? How are you? How are you feeling? When was the last time you felt what you felt, and did you name that emotion? Did you name that feeling? And did you give yourself that attention? We women, again, most of the women would, naturally love to live in a victim consciousness. I do not know why it happens, but then it happens. We need to change this perspective. We need to work around our own selves first. Do not ignore your emotions. Nature has equipped you equipped all of us, in fact, with these emotions. If they have given us life challenges, they have given us the tools to handle these challenges as well, right? Okay, so we are, okay, I'll do that. Where was I? I've just forgotten, where was I? So when we are facing challenges and life is happening to us, ask yourself 3 questions. What am I doing? How am I feeling? And why am I feeling this way? What can I do for myself to feel better? And when you feel better with your own self, you have a better relationship and you connect better with people around you, right? We all know that, right? So I would like to ask you again, just close your eyes for a moment. Close your eyes for a moment and ask yourself this question. Place your hand on your heart. When was the last time you spoke about the person you love and you care the most in your life? Whose answer, whose name is there? Take top 3 names. Did you leave yourself behind somewhere? Did you take your name of the people who you love in your life? The normal women, I mean, majority of women will come, my husband, my children, my this, and where do we put ourselves when it comes to self-love, self-care, self-compassion? We need to answer this. And then when we have this answer, we can actually answer, how are you, right? That's all I would like to say. Yeah, thank you.
Thank you so much, Rupali. Thank you. This is an amazing session because I've really learned a lot, especially about self-care and learning to put yourself first. Because women, like you said, you're always carried away by others, trying to fix the family, trying to fix the children, trying to fix your home, and then you forget about yourself. Thank you so much for really putting a lot of strength on this emotional intelligence issue, because it is a real big issue that we need to deal with.
Yes. And surprisingly, we were never taught emotional intelligence at our times when we grew up. Nobody used to pay attention. We were more on IQ.
True.
Develop your technical skills and a very rigid framework of growing up. And nobody spoke about emotions. Nobody gave importance to emotions, but then today we know that emotions drive people. And when you drive people, it's a motivating factor. And then when people are motivated enough, they are happy, they perform better.
Oh, thank you so much, Rupali. We really appreciate your time. Okay, we're going to move on straight to the launching of the counseling care line. Then after that, we can actually come back for questions. So don't forget to drop your questions in the chat box. If you have any question, if you need to directly to any of the speakers, please do. So we're going straight to the launching of the counseling care line, and it will be done by Mr. Shola Tinibu, who is the Managing Director of SCIBS Insurance Brokers. So ladies and gentlemen, I hope our hands are not too busy. Drop the emojis you need to drop on the chat box as we welcome Mr. Shola Tinibu.
Yes, good afternoon. Can you hear me?
Yes, we can. Yes.
As well, good afternoon, everyone. Well, it really gives me a great pleasure to be joining this afternoon. As you mentioned earlier, my name is Shola Tinibu, the MD of Skip Nigerian Co. Limited. And with the many things happening globally, challenging the health and lives of many, including the pandemic, which would seem to have taken the spotlight. We have some people who have dedicated themselves to ensuring that critical medical concerns, which haven't gone away, are still prioritized. So I say thank you to Mrs. Mojishola Animacham and the wonderful work yourself and the team are doing at St. Cyril Cancer Treatment Foundation. In all the madness that COVID has brought, some people must still concentrate on some of the ills of our society that are just there and are not going away. Today, as we launch the care line, I can already imagine the significant impact this is going to have on many cancer patients out there, knowing they will have people to listen to them and talk them through their healing process. So in the name of Almighty Allah, I declare this care line open. Thank you.
Thank you so much. Thank you, Mr. Tinubu. We really appreciate this. Is a very great initiative and everyone should actually key into it. So before we call it a wrap, I would want to appreciate everyone that has made efforts. Yeah, you can also drop your questions actually. We can take our questions. Oh, wow. Okay. So if you can see the screen, the care line is already there. Yeah. So you can have that. Very important, actually. Keep it safe because you may need it anytime. When you need someone, you may know someone that would need it at any point in time. Okay. So we're going to invite the Executive Director of St. Cyril Cancer Treatment Foundation to give us her remarks. Please let's put our hands together if it's not so busy and drop your love and emojis on the chat board as we welcome Mrs. Animashao. Good afternoon, Ma.
Good afternoon. Good afternoon, everybody. Nigeria really needs to be addressed. And it should be addressed for all, but most especially for cancer patients who are already going through physical aggravations. Now their mental health issues are added to that. So at St. Cyril, most of our patients, all our patients are given an opportunity to see our counselors. So we believe in holistic treatment, and we have been watching the mental health, taking care of the mental health of our patients, but we're going one step further. So I also want to use this opportunity to applaud Mr. Shola and Skip, because they are going to walk this journey with us at least for the next 12 months. They are supporting and they're partnering with our organization in ensuring that we help as many Nigerians suffering from cancer as possible by using the counseling care line, ensuring that we get treatment for them. We are ensuring that we have webinars and things, or physical seminars that would bring the mental health issue as it concerns cancer patients to the forefront. So thank you very much, Mr. Tinubu and the members of SCAPE. And thank you all for listening. I hope that you will not keep this information to yourself. Please share with other people and then make sure that they are aware that if there is any need for help, they know where to come to. Thank you again for listening.
Thank you so much, Ma. We really appreciate your time. And thank you for this fantastic initiative, because this is going to go a long way to help a lot of people who are not even aware of the emotions that comes with dealing with cancer and the treatments. Thank you so much. Really appreciate you. Thank you, everyone that made that time to join, to listen, those that contributed. A big shout out to King Hearts International. Thank you so much. We really appreciate you. Thank you, Ms. Rupali, for your time and expatiating a lot on emotional intelligence. Thank you so much, Mrs. Titi Layotade. We really appreciate you for your time. And to St. Cyril Cancer Care Foundation, we appreciate you. We hope forward to have a lot of work and help a lot of people as much as we can, because you know these things, we can never get enough of it. Thank you so much for the good work you do and keep up. So with all being said, I want to say thank you. My humble self, I am Amarachi Nelly, and I look forward to having more time with you all. Thank you so much and have a fantastic day.